Good morning, and welcome to our discussion. Today, we delve into a profoundly important and often debated topic. Should organ donation upon death be automatic unless individuals specifically opt out? This is the principle of presumed consent. To explore this complex issue, we have two distinguished guests. Dr. Eleanor Vance, a respected medical ethicist, who will argue in favor of presumed consent, and Mr. Samuel Green, an esteemed civil liberties lawyer, who will present arguments against it. Each will begin with an opening statement, followed by a moderated discussion and questions, and then concluding remarks.
Thank you, Mr. Weston. The reality we face is stark. Thousands of people die every year while waiting for a life-saving organ transplant. This is a profound human tragedy, a crisis that we have the potential to alleviate significantly. The current opt-in systems, while well-intentioned, simply do not yield enough organs to meet the desperate need. Many individuals who would be willing to donate never formally register their consent, often due to oversight or lack of opportunity. Countries that have adopted presumed consent models have consistently seen substantial increases in organ donation rates. For instance, nations like Spain and Belgium, which operate under this framework, report some of the highest donation figures globally, translating directly into more lives saved and improved quality of life for recipients. Ethically, we can view organ donation as a profound act of societal solidarity. A presumed consent system, importantly, does not negate individual autonomy. It merely reframes the default position. The crucial right to opt out remains, ensuring that personal beliefs and wishes are respected. This isn't about state coercion or the government claiming ownership of bodies, as some might fear. It's about establishing a default that reflects the altruistic tendencies of the majority, while meticulously protecting the right of individuals to choose otherwise. It's about making it easier to give the gift of life.
Mr. Weston, Dr. Vance, thank you. While the desire to save lives through organ donation is noble and universally shared, the method of presumed consent raises fundamental concerns about individual liberty and the very nature of consent itself. The human body is not, and should never be considered, state property to be harvested by default. True consent must be active, explicit, and informed, an affirmative choice made by an individual, not a passive assumption made by the state on their behalf. Imagine the potential for error or oversight in such a system. How can we guarantee that every individual, particularly the vulnerable, the poorly educated, or those with language barriers, fully understands the opt-out process and is capable of navigating it? The risk of misinterpreting silence as consent is too great. Furthermore, implementing presumed consent could inadvertently erode the crucial trust between the public and the medical profession. Patients might fear that their end-of-life care could be compromised by an overarching imperative to secure organs, however unfounded that fear may be. There are viable alternatives that respect autonomy, enhancing public education campaigns, improving the efficiency of current opt-in registration systems, such as at the time of driver's license renewal, and providing greater support and encouragement for living donation. These methods uphold ethical principles without resorting to assumptions.
Thank you both for your compelling opening statements. Dr. Vance, Mr. Green has voiced significant concerns regarding individual autonomy. Specifically, how can a presumed consent system ensure adequate protection for individuals who genuinely do not wish to donate, particularly those who might be unaware of the opt-out requirement or face practical barriers in expressing their refusal?
That's a crucial question, Mr. Weston, and one that any ethical presumed consent system must address comprehensively. The protection of individual choice is paramount, even within a system that shifts the default. Firstly, the implementation of presumed consent must be preceded and accompanied by extensive, clear, and multilingual public awareness campaigns. These campaigns would detail how the system works and, critically, how to opt out easily and effectively through various channels, online, by mail, or through healthcare providers. Secondly, many successful presumed consent models still incorporate a process of family consultation. While the legal default might be donation, medical teams would still engage with families to understand the deceased's likely wishes and to address any known objections, providing an additional layer of safeguard. The aim isn't to override dissent, but to better capture the altruistic intent of the majority, who polls consistently show are willing to donate but haven't taken the formal step to opt in. It's about respecting wishes, including the wish to say no, which must be made straightforward.
Dr. Vance's proposed safeguards, while well-intentioned, sound more like ideals than easily achievable realities across a diverse population. Public awareness campaigns, however extensive, rarely achieve universal reach or comprehension. The fundamental principle remains: the burden of action should lie with the act of giving, not the act of refusing. An individual should actively choose to donate their organs. The state should not assume this choice on their behalf simply because an opt-out form wasn't completed. Consider the practicalities. How do we ensure that individuals with significant literacy challenges, those with certain disabilities, new immigrants with language barriers, or those living in remote areas with limited internet access, are all adequately informed and empowered to opt out, if they so choose? Family consultation is a sensitive issue, but it shouldn't replace direct, explicit consent from the individual when they were capable of giving it. Relying on silence, or a failure to navigate a bureaucratic opt-out process and calling it consent, fundamentally misrepresents the concept of informed agreement.
Mr. Green, you've clearly articulated the ethical objections to presumed consent. However, we cannot ignore the pressing reality of the organ shortage and the many lives hanging in the balance. If presumed consent is not the answer, what specific, scalable alternative strategies do you believe could genuinely make a significant and, importantly, timely impact on increasing organ donation rates?
Thank you. The urgency is undeniable, but we must pursue solutions that uphold ethical standards. A key strategy is mandated choice, or required response. When individuals renew driver's licenses or national ID cards, they would be required to actively state yes or no to organ donation. This isn't presumed consent. It's prompting an active decision. Coupled with this, a significant, sustained investment in public education, starting from an early age, can demystify organ donation and foster a culture of altruism and informed choice. Furthermore, we must strengthen the infrastructure of our organ procurement organizations, ensuring they are well-funded and efficiently managed. Improving hospital protocols to guarantee that all potential donors are identified and that families are approached by trained specialists with sensitivity and respect at the appropriate time is also critical. These combined efforts can substantially increase donation rates without compromising the fundamental right to bodily autonomy and explicit consent. It requires commitment and resources, but it is the ethically sound path.
Mr. Green's suggestions are valuable, and indeed many of them, such as public education and improvements in procurement protocols, are ongoing efforts in many countries. We all support these measures. However, the hard truth is that even with these initiatives, the gap between organ supply and demand remains tragically wide. Mandated choice, while an improvement on purely voluntary opt-in, has not, in most places, achieved the levels of donation seen in presumed consent countries. It's important to state that presumed consent is not mutually exclusive with these other vital efforts. Enhanced education, better hospital practices, and robust opt-out registries are all integral components of a successful and ethical presumed consent framework. But given the persistent crisis and the proven success of presumed consent in significantly boosting donation rates elsewhere, it represents a necessary, bolder step. It's a pragmatic response to an urgent public health issue, complementing rather than replacing other strategies. In closing, the evidence strongly suggests that a carefully implemented system of presumed consent offers the most effective path to significantly increasing the availability of life-saving organs. Thousands of lives depend on us making this courageous and compassionate shift. This is about fostering a sense of communal responsibility, where the default is an act of profound generosity. It's about recognizing that the gift of life is one we can all potentially give. A well-designed system, with clear and accessible opt-out provisions and robust public education, absolutely respects individual autonomy, while maximizing our collective ability to save lives. It is a change that can bring hope to so many.
Ultimately, this debate centers on a bedrock principle: bodily autonomy and the necessity of explicit, informed consent. No matter how pressing the need, we must not compromise this fundamental human right by allowing the state to presume consent over our bodies. To do so risks unintended consequences, erodes trust, and sets a dangerous precedent for state assumptions in other areas of personal choice. The silent majority argument cannot justify overriding individual liberty. Let us therefore redouble our efforts on ethical, consent-based solutions, enhance education, improve opt-in mechanisms like mandated choice, and support our medical professionals. We can increase organ donation without sacrificing our core principles of freedom and individual sovereignty.
Dr. Vance, Mr. Green, thank you both for an exceptionally insightful and thought-provoking discussion on this critical issue. Your expertise has illuminated the complexities involved. We've heard compelling arguments for presumed consent as a means to save lives, emphasizing societal good and the continued right to opt out. Conversely, we've explored profound concerns about individual autonomy, the nature of true consent, and the potential risks of such a system. This debate touches upon deeply personal and ethical considerations, and we encourage our viewers to reflect further on the arguments presented today. Thank you for joining us.